going to look at the Bernard-Soulier syndrome, and as we begin, we are going to ask some questions. That is, the first question is, what is the inheritance patterns of this disorder? And second one being, what is the mechanism of this disorder? So in this video, we'll find out the answers to these questions and learn in detail. So to begin with, the first, we need to know what is the inheritance pattern. So the inheritance patterns of this disorder, it is nothing but it is autosomal recessive. Then as we move on to the defect, what does the defect lie on? The defect is on the absence. There is an absence of the GP1B9-5 receptor. So this is the receptor which is involved. And what is the mechanism? If you see the mechanism, it is the lack. There is a lack. There is lack of the GP1B9-5, and this prevents the platelet adhesion. It prevents the platelet. It prevents the platelet adhesion to what? The platelet adhesion to the VWF, that's a von Willebrand factor. Now when we look at the platelet count, so what is the platelet count? In this case, the platelet count is nothing but there is a normal platelet count. There is a normal platelet count, and if you see, there is a mild thrombocytopenia. There is a mild thrombocytopenia. Next, we will look at the platelet morphology. How is the morphology of the platelet? So if you look at the platelet morphology, there is significantly large platelets, and there is also the megathrombocytes. There is a megathrombocytes, and this is with the dense granules. It is a dense granules which are present. Then we have the bleeding time. What about the bleeding time? The bleeding time is nothing but it is prolonged. And then we have the platelet aggregation. So what is meant by the platelet aggregation test? So it includes the collagen. There is also the ADP and the thrombin. So all this is nothing but normal. And then there is something known as the risto. There's something known as the ristocetin aggregation test. So this, it implies that it is abnormal. That is, the platelets, it do not aggregate. There is no aggregation. The platelet, it does not aggregate. And then other point to note is that it does not normalize. It does not normalize after the addition of normal serum. And then when we look at the VWF factors, so the VWF factor levels, so it is nothing but normal. And then when we look at the PT-PTT, so this is also normal. Now we'll move on to answering our question. The first question we asked was, what is the inheritance pattern of the Bernard-Soulier syndrome? So the inheritance is nothing but it is AR, that is the autosomal recessive. And next, when we look at the mechanism, so what is the mechanism of this? So mechanism is that it lacks. There is a lack of the GP1B. There's lack of GP1B9-5. So what this does is it prevents the platelet adhesion. It prevents the platelet adhesion or to the von Willebrand factor.